Our second topic, which is the models of health. I gave you one definition of health. I did not give you several other definitions of health, but they do exist. I only stress the fact that the definition of health by WHO is what is commonly used. That does not mean that people's understanding of what health is actually the same. Okay, so as public health professionals, we have different ways of looking at health, understanding what health is and what can we do to improve health. So if you understand the problem quite well, that is when you can actually be able to address the problem. So our understanding of health is very important, and the models help us help us in understanding what actually health is and how we can address health. So that's why these models of health are actually very important. So let's look at them. So by the end of the presentation, you should be knowing what health models are and why we use them. And then we shall look at the different health models and also understand the concepts and components of each of them. And then we should have an idea of how these models can be applied in improving health, whether through health promotion, disease prevention, or even healthcare interventions. And for each of these models, do we have any limitations, or what are their strengths? That's the discussion that we are going to have here. So in public health, when we use the word models, we are basically referring to a simplification of how certain health issues actually relate to one another. So you will hear different models throughout your program. So when we talk about models of health, we are talking about insights, okay, approaches that help us in understanding what health is and how we can promote health. So in public health, generally, we have very many models, okay? We have very many models of health, but also generally very many models in public health. Okay, so in this discussion, we are going to look at 4 of them, but of course, they are not the only ones that we have here. They are not the only ones that we have in public health. So we have biomedical model of health. We have the second one, which is the biopsychosocial model. We have the ecological model of health. We also have the life course perspective of health. These are the ones that I've just chosen, but another assignment to you is that look out for other models.